be performing goniometric measurement of the elbow flexion. First, the positioning of the client is supine with the hand supine as well. I'm positioned on the side of the client to get a good measurement, good reading. First, I'm going to do a quality check on the client. Go ahead and flex your elbow. I'm going to feel for the end feel. Relax. Next, I'm going to place the axis of the goniometer on the lateral epicondyle of the humerus with the stationary arm at the midline of the humerus, pointing at the acromion process, with the moving arm placed on the midline of the radius at the styloid, pointing at the styloid process of the radius. So we got about 149 degrees of elbow flexion. Next, I'll be performing a goniometric measurement of knee flexion. First, positioning of the client is supine. I'm positioned on the side to get a good measurement reading. We will perform a quality check of the knee flexion first. Go ahead and flex your knee, please. I'm going to feel for the end feel. Relax. Next, I'm going to be placing the axis of the goniometer on the lateral epicondyle of the femur. The stationary arm placed at the midline of the femur, pointing at the greater trochanter, and the moving arm placed at the medial line of the fibula, pointing at the lateral malleolus. So it looks like we got 142 degrees of knee flexion. I'll be performing goniometric measurement of the cervical spine flexion to the right. So first, the position of the client. Client is sitting with the back support with the lumbar spine and thoracic spine stabilized. I'm positioned behind the client, and I will be performing a quality check first. So go ahead and flex your neck to the right, pointing to the right. I will test for the end feel as well. Go ahead and relax. Next, I will be placing axis of the goniometer of this spinous process of the C7 vertebrae. Right here. Stationary arm is going to be placed along the side of the spinous process of thoracic spine. Moving arm is going to be in the midline of the head at the occipital protuberance. Go ahead and flex your neck to the right. Flex. Alright, the client has 48 degrees of cervical spine flexion to the right. Next, I'll be performing goniometric measurement of the trunk lateral flexion. So first, the client position standing with the pelvic floor stabilized. I'm positioned behind the client to get a good reading of the measurement. So we first going to perform the quality check. So go ahead and flex the trunk to the right. With the hand pointing at the heel. I'm going to feel for the end feel next. So the axis of the goniometer is going to be placed at the S1 spinous process. The stationary arm is going to be pointed down vertically. Moving arm is going to be placed towards the C7 spinous process. Go ahead and flex your spine to the right now. So the client has about 49 degrees of lateral flexion of the trunk to the right.